Hello, I'm Dr. Hafsa. Are you ready to say goodbye to indigestion? Let's explore some practical tips together for a happier, healthier tummy. Do you get a stomach ache or upset tummy right after you eat? Well, you might have indigestion, in which there is a feeling that your upper belly or stomach is on fire. Basically, this pain or discomfort occurs after you eat or while your stomach is digesting. This term is medically known as dyspepsia. So, what really causes indigestion? There are a few conditions like sores or ulcers in your stomach or small intestine, gastritis, which is the inflammation of the inner lining of your stomach, which can be due to infections like H. pylori, which is also a very well known cause of gastroesophageal reflux disease, also known as GERD. In this, the acid in your stomach goes back into your food pipe or esophagus. Gallstones and pancreatitis also contribute to an ineffective digestion. Food sometimes moves too slowly out of your stomach. This condition is known as gastroparesis, and this generally occurs in patients who are diabetic. Other than this, there are a few lifestyle factors like smoking, caffeine, alcohol. All of these irritate your stomach lining, and this can eventually lead to ulcers, sores, inflammation, redness, bleeding, and many other factors. Eating too fast or too much leads to an increased stretch on the walls of the stomach, and this can lead to the acid escaping too quickly out of your stomach into the esophagus. Eating spicy, fatty, or greasy foods, eating high fiber foods, all of this can lead to indigestion. Feeling very stressed or having anxiety can lead to indigestion. As you all know, your gut is known as your second brain, and your gut and your brain have a very strong relation, and I will make a separate video on this. How do you know that you have indigestion? You might be having these symptoms: feeling full too soon while you're eating, having pain or burning sensation in your upper belly, feeling bloated, burping, having gas, having an upset stomach or vomiting, having diarrhea. All of these symptoms contribute to an ineffective digestion, also known as indigestion or dyspepsia. There are a few tests that need to be done for the healthcare provider to rule out the cause of your digestion. The blood tests rule out if you have anemia or any kind of metabolic disorder that can lead to a disruption in your digestion. Stool or blood tests rule out if you have H. pylori infection. X-rays of your stomach and small intestine can find out any kind of intestinal obstruction. Upper endoscopy is done in a way that a flexible tube is inserted from your mouth into your esophagus, and this tube has a camera at the end of it. Now, this camera helps us to see the inside of the esophagus, and by this, we can see any kind of ulcers, inflammation, obstruction, or anything that can lead to slowed digestion. Ultrasound of your gallbladder is necessary if you are suspecting gallstones. Stomach emptying scan is done to check whether your stomach is digesting timely, and this is necessary in patients who have diabetes, as it can lead to gastroparesis. Here are a few things that your healthcare provider can prescribe. Histamine receptor antagonists like ranitidine or cimetidine, proton pump inhibitors like omeprazole or esomeprazole. Both of them block the acid secretion so that the acid cannot regurgitate from the stomach into the esophagus. Prokinetic agents are given to speed up the digestive system. Examples include metoclopramide or domperidone. Antibiotics are given if you have an H. pylori infection. Other than this, what you can do on your part is eating small, several low fat meals each day instead of three large meals. Eating slowly and giving yourself enough time for the meals to get digested properly. Limiting your spicy, fatty, greasy, or high fiber intake. Chewing your food well so that the enzymes in the saliva are released and they aid in the digestion process. Limiting or not having any coffee, soda, or alcohol so that you do not irritate your gut lining. If you found this video helpful, please like and subscribe for more content like this.